Is type 2 diabetes curable? If we look at the American Diabetes Association website, it states the target is to manage or live with diabetes. For most people, type 2 diabetes is a progressive disease, which means it will get worse. Eventually, oral medication may not be enough to keep blood sugar level normal. Insulin is then needed to get blood sugar level to a healthy level. This is the normal progression of type 2 diabetes. First, high and prolonged blood sugar level cause the pancreas to produce large amounts of insulin throughout the day. The insulin causes weight gain, fatty liver, and fatty pancreas. As the muscle cells become full of fat, this would lead to insulin resistance. The cell would become more and more resistant to insulin. Prolonged insulin resistance will lead to type 2 diabetes. Type 2 diabetes can lead to many health complications and death. This is the current diabetes treatment strategy, which is mainly focused on reducing blood sugar. Once a person has high blood sugar, they are normally given a drug called metformin. Over time, more and more drug would need to be used to control the high blood sugar. And then insulin would be needed to lower the blood sugar. Insulin will cause weight gain because insulin is basically a fat storing hormone. This in turn will cause fatty liver and pancreas, which will cause insulin resistance as time goes by. The insulin resistance will get worse. More and more insulin will be needed to be used until the overall health status of the patient deteriorates and he or she dies from diabetes complications. The current treatment protocol for diabetes is to normalize blood sugar. So these are the actions. More and more drugs are used. As the cell becomes full of fat and not able to accept more blood sugar, the cell will become more and more insulin resistant. More and more insulin will then be needed to lower blood sugar. In addition, many doctors will also recommend patients to have lots of small meals to offset blood sugar spike and crash. However, this will cause the patient to be in a state of high insulin throughout the day, which will prevent the body from burning fat and losing weight. The results of these would be weight gain, fatty liver and pancreas, insulin resistant, type 2 diabetes, the diabetes will get worse, and other health problems. Therefore, type 2 diabetes with the current treatment has no cure and will lead to death. So, what is insulin resistant? Insulin resistant is an overflow phenomenon. When you eat food that are high in carbs, sugar, or processed food, this will increase your blood sugar level. The pancreas will produce insulin to take the glucose and store it in the cell as fat. However, with high and prolonged blood sugar level, your cell will become full. The pancreas will need to produce more and more insulin to push the glucose into the already full cell. To a point, even with more and more insulin, the cells are not able to accept any more glucose or sugar. This is called insulin resistance. The insulin and the blood sugar level will build up, which will cause type 2 diabetes. This is the insulin and diabetes cycle. First, when we excessively eat food with high sugars and carbs, this would lead to high blood sugar. The pancreas will produce insulin to take the blood sugar and store it as fat in the cell. Over time, this will cause rapid weight gain, fatty belly, livers, and pancreas. As the cells get full, they will become insulin resistant or not responsive to insulin. Insulin resistance will lead to type 2 diabetes. Type 2 diabetes will force the body to need more and more insulin, which will store more and more fat. Diabetes will get worse, and this is why a typical diabetic on a current diabetes treatment will not improve but will get worse and worse over time. In addition, insulin and diabetes also have a twin cycle. High blood sugar will cause production of insulin, which will lower the blood sugar but will store fat in the cells and muscle. This will cause weight gain, fatty pancreas and livers, which will cause beta cell dysfunction. This will prevent the body from using or burning the fats. This will cause higher blood sugar and insulin. Prolonged insulin and too much fat in the cell will cause insulin resistance, which will cause the need for more insulin and type 2 diabetes. Diabetes has many complications. These are the diabetes complications: stroke, blindness, high blood pressure, kidney problem, fatty liver and fatty pancreas, cancer, lower limb diseases, depression, brain malfunction, heart problem, beer belly, erectile dysfunction, diabetic foot. This is the current typical type 2 diabetes treatment. The current response to type 2 diabetes focus mostly on the management of blood sugar, not to treat, reverse, or cure type 2 diabetes. To make it easy to understand, I have these two examples. You have a cut, and the cut gets infected. The cause of the infection is bacteria, so the normal treatment would be to give some antibiotic. The symptom of the infection is high fever. To treat the fever, you would be given acetaminophen or Tylenol. Now, let's look at insulin resistance, which will lead to diabetes. Insulin resistance will cause weight gain, fatty liver, and pancreas. The normal treatment for this is no action. The symptom of insulin resistance is high blood sugar. The treatment for this is to give drugs and insulin, which will increase weight gain and worsen insulin resistance and diabetes. The current action or treatment only look at the symptom, not the cause. This is why most people still think type 2 diabetes is not treatable and it is a progressive disease. The current type 2 diabetes treatment will lead to an endgame. It has and will continue to cause long-term and progressive suffering, large financial burden to the families and the state, and will lead to death. In conclusion, the current treatment for type 2 diabetes is idiotic. You can't treat a high insulin state with more insulin. You need to focus on treating the cause, not the symptom. So what should we do? Here is the pathway to reversing type 2 diabetes. The first pathway is diabetes and its complication. Eating food with high sugar and carb, snacking or eating all day, and not enough exercise will lead to rise in blood sugar. Your pancreas would produce insulin to reduce the blood sugar level by storing it in the cell as fat. This will lead to weight gain, fatty livers, and pancreas. Over time, the cell will become too full and cannot accept any more sugar or fat. This will lead to more and more insulin resistance. The cell will become more and more resistant to insulin. Insulin resistance will lead to type 2 diabetes. Type 2 diabetes will lead to diabetes complication and death. Now, let's look at the pathway to reversing diabetes and its complications. The steps required are fairly simple. First, cut out sugary and high-carb food, do fasting and regular physical exercise, which will lead to lower blood sugar. Your pancreas will not need to produce insulin. With little or no insulin, your body would be able to start burning fat. This will lead to weight loss and reduced fatty livers and pancreas. Over time, the cell will no longer be full and would be able to accept more fats. Insulin resistance will be reversed, which will lead to reverse type 2 diabetes. With no more type 2 diabetes, this will lead to reduced diabetes complications. Type 2 diabetes is too much insulin, which causes weight gain, fatty liver and pancreas, and insulin resistance. Therefore, to reverse type 2 diabetes, you would need to cut sugar consumption, do low carb diet, do intermittent fasting like 16-8 or 18-6, get enough sleep, reduce your stress, and exercise regularly. The result would be lower blood sugar, reverse fatty liver and pancreas, reduce weight, which will free up your muscle and cell, decrease insulin resistance, and reverse diabetes. Yes, type 2 diabetes can be reversed and cured. The best of all, the cure requirement require no cost, no drugs, no time, no surgeries. It only requires knowledge, courage to challenge conventional thoughts and action. So let's get started. Here is a blood sugar level chart taken during fasting and after 2 hour post meal. Thank you.